Well, hello everyone. In today's video, we're going to talk about Medicare Supplement Plans, also known as Medigap plans. We're going to compare Medicare Supplement Plan G versus Medicare Plan N. By the end of this video, you will be able to determine which route you want to go. Do you want to go with the Medicare Supplement Plan G or a Plan N? So keep watching this video if you want to know the differences, the costs, and the pros and cons of Medicare supplement plans. Hello there, my name is Patricia St. Louis, and I help my clients with Medicare plans, health insurance, also known as ACA, also known as Obamacare, and life insurance as well. Alrighty, let's get started. So first, we need to talk about original Medicare. What is original Medicare and why do you even need a Medicare supplement plan? So original Medicare is health insurance for individuals 65 and older that work in the U.S. and pay Medicare taxes for at least 40 quarters, at least 10 years, okay? Or if you have a disability, you can also get Medicare as well, which is original Medicare. So original Medicare is health insurance here in the U.S. Now, the thing about original Medicare is there are some gaps, there are some holes, and we want to help you fill in the gaps. So original Medicare covers 80% of your medical bills, leaving you behind 20%. So this is why Medigap plans, also known as Medicare Supplement Plans, exist. It covers that 20%. With original Medicare, there are two parts. You have your Medicare Part A and you have your Medicare Part B. So Medicare Part A covers your hospital coverage and Part B covers your medical coverage, okay? So like I said, original Medicare covers 80%, leaving you behind 20%. So you're going to have a Part B premium. You already paid for your Part A when you was working, when you was paying Medicare taxes. So you still have to pay your Part B premium when you get on a Medigap plan, okay? So there's going to be a additional premium for your Medigap plan, okay? So I usually work in Florida. My office is based out in Florida. So I'm going to base the monthly premiums range in Florida, okay? So in Florida, we're looking at, depending on your zip code, of course, about $190 or so for a Plan G plan, or you could do a Plan N and it's going to cost you about $30 less. So ballpark, you're looking at about $400 give and take when you add your Part B premium, when you add your supplement premium, and of course you need a drug plan as well. So we got the cost out of the way. Let's talk about why individuals love Medicare supplement plans, okay? So like I said before, original Medicare only covers 80%. So the supplement will pay the 20%, giving you 100% of coverage. Any services that original Medicare allows, then the supplement will follow that service, okay? So any type of medical services that original Medicare allows, the supplement will follow. So like I said, original Medicare pays 80% and the supplement pays the 20%. Let's talk about the pros and cons of having a Medicare supplement plan. So my clients say that the pro is definitely that you can travel with this benefit. You could be in New York for 6 months. You could be in Florida for 6 months. As long as the doctor takes original Medicare, they will take your Medicare supplement plan as well. You don't have to worry about any network whatsoever. So you would not call and say, do you take this Medicare supplement plan? You would say, do you take original Medicare? Are you accepting new clients? new patients. And if they say yes, then you're good to go. You could go ahead and set up that appointment. Another pro of having a Medicare Supplement Plan is that as long as you make your monthly premium, you are good. The company cannot drop you if you get sick or anything like that. And another pro is no pre-authorization. What does that mean? The insurance carrier can say no to certain services, but when it comes to a Medigap plan, a Medicare Supplement Plan, no pre-authorization. As long as Medicare says yes, then the supplement must pay that 20%. Now let's talk about the con of having a Medicare Supplement Plan. The only con is really if you cannot afford the supplement. It can be a little pricey depending on where you live in the world. Like I said, in Florida, the supplements can be a bit pricey, especially if you are on a fixed income. Alrighty, so we got the cost out of the way. Let's compare a Medicare Supplement Plan G to a Medicare Supplement Plan N. So these are the benefits covered by Medigap plans, also known as Medicare supplements. Okay, we're going to go ahead and discuss Plan G, what Plan G covers, okay? So your Part A hospital coinsurance and 365 extra hospital days is covered by Medicare Part G at 100%. Your Part A deductible is also covered at 100%. Your Part B coinsurance or copays covered at 100%. Your Part B annual deductible is not covered under Part G or Part N. So what is a deductible? So the deductible for 2024 is $240 for the year. So that means you have to pay that $240 before the plan actually kick in, okay? Now let's talk about Part B excess charges. So excess charges is when the doctor can charge excess charges over what Medicare charges. So if Medicare charges, let's say $100 for that service, the doctor can say, I actually charge $150. Part G covers those excess charges. Cost of blood transfusions, 3 pints, is also covered at 100% under Part G. Foreign travel for emergency, there are limits, is covered at 80% under Part G. Hospice care coinsurance cost is covered under Part G at 100%. Part B preventive care coinsurance is also covered under Part G at 100%. Your skilled nursing facility care coinsurance is also covered at 100%. So let's talk about Plan N. Plan G covers the Part B excess charges. Plan N, however, does not cover Part B excess charges. So if the doctor wants to charge you an additional $50, $100, or whatever the excess charges are, you will have to pay that extra charge. You do have some copays. Plan G, there are no copays. Plan N does have some copays. So you're going to pay up to $20 to see the doctor, and you're going to pay up to $50 for the ER visit. So these Medicare supplement plans are offered by certain insurance carriers. So how do you know what insurance carrier to go with? All the insurance carriers must offer the same benefits under a Medicare supplement plan. The only difference would be the monthly premium that you actually pay to that health insurance carrier. So how do you know which one is better than the other? Okay. So the most important thing for you to understand is picking a company that's stable in the market and has steady rate increases and not hijack the price to the point where you can no longer afford it. So please, if you get nothing else from this video, work with a broker that you trust and that can help you make a great decision when it comes to choosing the carrier that's going to offer you that Medicare Supplement Plan. You do not want to sign up with an insurance carrier that's going to start with a very low rate, and then 3 years, 4 years, or whatever down the line, the increases are so high that you can no longer afford the supplement. Because this is the thing, you will have to go through underwriting if you want to change your plan. And if you are sick, you cannot pass the questions, then you would not be able to change the Medicare Supplement Plan. So it's very important to work with a broker that understands the market. You want to get with the insurance company that is very steady and stable in the market, that don't have to, increase your rates and have a history of steady rates, because your rates are going to go up year after year. Let's talk about some key things that you need to understand when choosing a Medicare Supplement Plan. Number one, they do not come with extra benefits. So you're going to need a dental plan if you want dental insurance, vision plan. All of these plans are standalone plans. They're not attached to a Medicare supplement. Also, prescription drug coverage. You're going to need a separate drug plan as well to cover your medications. Even if you're not taking any medications whatsoever, you still need a drug plan. If you don't get on the drug plan, you will be penalized for not being on one. So it's very important that you have everything taken care of, okay? So your Part A, your Part B, your supplement, your drug plan, and if you need any additional like dental, vision, and hearing, those are separate policies as well. So remember, Medicare Supplement Plans is considered the Cadillac of Medicare because you can go to any doctor that takes original Medicare and you don't have to worry about pre-authorization. And one more key thing is that the best time to enroll in a Medicare supplement is when you're first eligible to do so, because there's no underwriting questions. What does that mean? So when you first turn 65, you have the opportunity to get on a Medicare supplement plan. It does not matter your health condition whatsoever. They will not ask you any health questions. You could go ahead and enroll after 6 months. However, you will have underwriting. So as long as you're healthy, you can change your Medicare supplement plan as long as you can pass underwriting, okay? And after that, you have to go through underwriting. And if you're too sick, then unfortunately you won't be able to change your plan. So I always tell my clients this. This is what you need to look at when you are wanting to get on a Medicare supplement plan. Number one, look at your budget. Can you afford it now and for the remaining of your life? Because it's going to increase year after year. And number two, look at your family health and your health. Do you feel like the Medicare supplement would be a better fit? Because remember, no pre-authorization whatsoever. Long as Medicare covers that service, the supplement will follow. Anyways, thank you so much for watching. I hope you enjoyed this video. Please like, comment, share this video with a friend. And like I said, if you need any assistance, give our office a call. We'll be more than happy to assist. Thank you so much for watching. Bye.